Another in our series of Facebook Live events. We're going to answer increasing still. Which is very, very good news. However, we're still on the lookout for new cases. We can only do 50 or so.
You're going to take it.
All right. Hi, this is Dr. Bob Dannenhofer, Public Health Officer from Douglas County. This is one in a series of Facebook Live events that we've done, and today's a big day. So I will tell you that today is sort of an ominous day throughout the world. We hit our 200,000th case of COVID throughout the world, almost 8,000 deaths. So it really is here, and it's really spreading around the world. The good news, China seems to have this under control. They had very few new cases over the last week, and Korea seems to be getting this under control, as well as Singapore. However, in other places in the world, like Italy, Iran, France, Spain, and Germany, we're seeing a rapid increase in cases. And sadly, in the United States, we're also seeing a rapid increase in the number of cases. So we had over 1,000 new cases today. There are big hotspots of the disease in Seattle area, in California, and New York and Florida. Not surprising, because those are the most populous states. Oregon has continued to have an increase. We had about 12 new cases and 2 new deaths reported today. The good news then, Douglas County, we still have just that one case, and now we're about 10 days after diagnosis. So it's likely that there are going to be no secondary cases from that first case. That's exactly what public health is here to do. Find a case, take care of the people around it, so that there's not going to now be a secondary case. The other thing that I've been teasing people about in the last week is about testing. And I know we've been saying that testing is coming up, and I will glad to announce testing is up. So we had a great event yesterday. We did a drive-through flu clinic at the fairgrounds. This was a big event. It took a lot of partners here, including, and I'm sure I'm going to forget people, the people at the fairgrounds, the sheriff's office, fire, COAD, the people from Mercy, the people from all the clinics, and of course the great people from DPHN that put this together. Yesterday was just a pilot to see how long it would take to move people through, and to see if there were going to be specific difficulties. I will tell you, we were able to get people through quickly, about 3 or 4 minutes per car. We were able to do this very safely, so that the 2 people who were doing collections, me and Dr. Gray, were in high efficiency particulate respirators. So we were very safe when we did this. I wouldn't send any of my people in there to do it unless I thought I was safe. So I went first, and similarly with Dr. Gray. So we did it. We did the 17 tests. They got sent off to Quest Lab, sort of a circuitous route. They went from the fairgrounds to the Quest office here in town, to the airport, to Seattle Airport, to Quest Labs, some processing was done, back to Seattle Airport, down to San Juan Capistrano, where the tests are run. So it's a bit of a circuitous process. We expect to get the results back in about 2 to 4 days, and then the providers who order those will get those back. It's kind of a grody procedure. You can see on our website what the procedure looks like. I actually demonstrated this a while ago, and it's no fun. And everybody who had it done said, boy, that was memorable, although it really didn't hurt. So the good news is I think we have it up now. I think by Friday we'll be able to do about 50 tests at our clinic on Friday. We're also going to do it at the fairgrounds. I think we're going to be able to get it done and get those off Friday so that we should get results on Monday and Tuesday. The results will go to the primary care providers who order them, and then they'll deal with those. Now, again, the testing is important for us to know who has it and who to quarantine. However, a positive test is very helpful, because if it's positive, you have it. There's almost no false positives in this. If it's positive, you got it. However, there are a lot of false negatives. This is a funny test. If you go a little too early or a little too late, you're not going to find it. And so if you have symptoms and a negative test, doesn't mean you don't have it. It means that the test wasn't positive. So we have that limitation, but it's really important to know, because the test is pretty good and will pick up most people who have it, although not all. So there are a lot of questions on there on how you get a test. I would please ask people to hold off calling their providers until tomorrow at noon. We just got the approval to go ahead and do this on Friday, so we're getting information out to providers tonight and tomorrow morning about how to order this. What we're going to do is we're going to get these orders from the provider. We're going to do the first 45 or 50 that come in and then schedule those for Friday. A couple of things I ask. One is, please protect people's privacy. I mean, these are people who may be sick, and any of us who are sick may not want our pictures on Facebook or on the front of the newspaper. So please respect the privacy of the people who do it. And secondly, we're going to do this at the fairgrounds. We have a lovely, efficient setup. But again, if we have a lot of gawkers or people there, it's just going to slow it down. So please avoid the fairgrounds if you can, unless you need to be there. And otherwise, you can contact your doctor, but recognize we may not have the procedure fully done until tomorrow. So one of the questions is, explain the actual test and the process. So the actual test in this is what's called a nasopharyngeal swab. So your nose is connected to the back of your throat, and in the back of your throat you have lots of lymphoid tissue, and some of the viruses live there. Actually, most of the viruses live in your lung, but there's no way to get a good sample from deep in your lungs. So second best is this nasopharyngeal swab. I don't think we have one here, but they're about as long as a Sharpie. They're a little thinner than that, and basically it goes in the nose about 5 inches. It needs to sit there for a few seconds. It then gets twirled around to pick up some of the boogers, sits there for another 4 or 5 seconds, and then we pull it out and put it in a viral transport tube. It is distinctly uncomfortable. I've had it done to me a few times, teaching other people how to do it. It's distinctly uncomfortable, but it really doesn't hurt. We get a good sample. I think all of the samples we got yesterday were great samples, and not a single patient were we unable to get a deep nasopharyngeal thing. What happens then, it gets put there. We typically have people wait for a minute or two to be sure they're okay. It is a little shocking. And then if they're okay, they can drive off. Again, then we send it off to the lab, and we expect to get the results back in about 2 days. So are there more questions about the testing? Is the VA going to send veterans who can drive to get testing? We do not know this. We will check with the VA tomorrow. How are we going to help the people that don't have a PCP or insurance? And this, Renee asked this question. This is a great question. We do not have a great answer for that. Again, you have to have a doctor who orders this, because the doctor has to get the results. So we're working with some of the clinics in town to see if we can figure out a way to do for people who don't have insurance or don't have a PCP. But this is why I tell everyone I know the most important thing you can do for your health: stop smoking, get a flu shot. But after that is to get a PCP. So the story is, how do I get tested if I have symptoms and diabetes, but my doctor won't refer me for the test? Well, the test is, again, people have this thing, that the idea that they can get this test and know forever that they're not going to have coronavirus. So if you're not acutely ill with fever and a cough, the test is not helpful. The test is most helpful for people who have fever and a cough for more than 2 days, but less than 12 days. So you do it in the first or second day of the illness, it's not likely to be positive, and it's likely to give you false reassurance that you don't have it. We saw a few people yesterday, it seems longer than that. Yesterday we did this, we've been sick for 6 weeks. It's again very unlikely to persist for 6 weeks. So we're trying to go ahead and focus people who've been sick somewhere between 2 and 10 or 2 and 12 days. Again, before yesterday, there was really no place for your doctor to refer you. Starting tomorrow, there will be, so you make him a call. So the question is, how many tests are you hoping to do a week? And this is going to be, Laurel asked that question. This is a good question. There are numerous glitches in this. The first was the collection. I think we handled that. The second one, which seems a bizarre thing, is a lack of the tubes and the viral transport media that this needs to get sent in. We have only about enough tubes now for about 50 tests. So we'll be able to do Friday. We're going to have to see if we can get more of these tubes. But when I've talked to public health people in the rest of the state, these tubes are very hard to get. And without the special test kits, you can't do it. It would seem absolutely foolish if that's what's going to be the limiting factor, but it will maybe. So what if you taste positive? And Lacey asked this question. And the story is that if you test positive, it doesn't really mean that much different. Anybody who has the symptoms of fever and cough should stay home until they're well, and then one day more. If the test is positive, a couple different things will happen. One is we'll want you to stay home until you're asymptomatic, plus 3 days more, or we'll want you to stay home for 14 days, whichever is longer. So, the people who have this and have this cough sometimes cough for 4 to 6 weeks. So I talked to somebody today who had one of the early cases, still coughing like a big dog at 4 weeks, and they're still needing to stay at home. But when the test is positive, it's important for us to know, because we'll track all of your contacts and then be sure that they're high priority for testing. So Laurel asked this other good question. Is drive-through testing going to be open for anyone in the public whose doctor recommends getting tested? What are the guidelines doctors are being told? So again, what we would like is to have people with fever and cough between 2 and 12 or 2 and 14 days. Again, the person who just got sick this morning, not a good candidate. The person's been sick for 6 weeks, not a good candidate. The person has a chronic cough from asthma, not a good candidate. But again, fever and cough for 2 to 12 or 14 days. This is a great question that I've heard a lot. So you say, I was pretty sick in the wintertime with this bad fever and cough. Is this the same illness that came through in January? The answer is, I think not. There is a very elegant study that was done up in the Seattle area that looked at all the people had fever and cough throughout the time, and they picked up COVID early, but not early January. So they didn't pick up COVID until the end of January for Seattle, and we don't think it was here before that. So I don't think so. But in a few months, they're going to come up with an antibody test. So antibodies are the things that your bodies produce to fight off infection. And before this, you had very low levels of antibodies because you hadn't seen this virus before. You'd seen this virus, and now you should have really high levels of antibodies. When that antibody test comes out, we're going to test these people who were sick in December and January and test them for this and see if they had it. I think the answer will be no, but I don't know the answer, and that's why we'll do the test. So if people are healthy and symptom-free, can they spend time outside together at a safe distance? And Leanne asked this question. And this is a good question. So certainly there would be absolutely no reason to go out by yourself, no reason not to go out by yourself, to go for a walk or a bike ride. Now, can you go out with somebody else? Again, remember, we're trying to do social distancing. So this is somebody you live with, like my wife. Obviously, we're together all the time. So yes, we could go out together. Seeing somebody new and different or going out for a group walk, I'd probably hold off on those for a while because that, again, increases the number of people you come in contact with. So the last time I described when they said, what do you mean by social distancing? So I brought my Sharpie with me today. So imagine if I had a Sharpie and anybody who got with an arms ring, I could mark their head with a Sharpie, and then they got a whole handful of Sharpies, and anybody they came in contact with, they could mark their heads, and then they got some Sharpies and they marked this. And you could imagine at a place like the Blazers game, everybody would leave all marked up. And so all of those people are potentially exposed. And so, going on a walk with your wife, presumably you were in the house in the morning, so you're each all marked up, but you're not marking up anybody new. So again, we're trying to limit social distancing. And what people have found in this is you don't have to be perfect. You don't have to be a hermit and have 0 contacts. But it's much better to have 1 or 2 contacts rather than have 300 contacts, because 300 contacts really increases this. the chance of getting it. So somebody asks, does ibuprofen and Tamiflu make corona symptoms worse? Well, we don't know. We do know that Tamiflu doesn't make it better. There's no reason to think it would make it worse. Now, ibuprofen is an interesting one. So what happens when you have an inflammatory response, your body makes these things called cytokines, and they have all unpronounceable names, like interleukin-6 and whatever. And we do think the cytokines are important. And the way ibuprofen works, it interferes with the cytokines. And so it is possible it could have an effect. Again, the Chinese are doing lots of study on this, and they could tell us. I don't think there's anything printed about this. I did see a report yesterday about this. And, there's a lot of theoretical things that come out. I'm really kind of a nerd about this. So I've read maybe 30 articles about this today, about things that work and don't work and make it better and make it worse. And these are all suppositions. None of the stuff is yet proved. Now, the story is ibuprofen and Tylenol work pretty well for this. And if there's a question, you could just take Tylenol. I don't have any problem with that. So if it's time for a pneumonia shot, is it safe to get one right now? Again, using the guidelines about social distancing, perfectly fine. We had kids in the office today getting shots for other things, and with appropriate social distancing, that would be fine. So is it okay to occasionally go to places if we don't have symptoms? Again, remember my magic marker, I probably wouldn't go to bingo with 84 of your elderly friends. But, is it fine to go out occasionally? Sure, I went out this morning and got my typical breakfast of bagels. I'm here now with 3 other people. So you can do it, but the story is the more you can limit it, the better it is. So will you be releasing the results of the test in general numbers, like how many positives, about how many tested? We will indeed. So we are perfectly happy to tell about the overall level of disease in the community, because that helps people to know how much is out there. We're not going to release the ages or their date of birth or their phone number or Facebook page, because people really do need some privacy. So with such limited testing available right now, how are we going to decide which doctors order tests? Right now, we're asking people to use their good judgment. At some point, we may need to limit the doctors. But again, most doctors don't have that many patients who have 2 to 12 days of fever and cough right now. When we checked among some of the busiest doctors in town, they said they had 2 or 3. So putting all the primary care doctors together, that probably is the 40 or 50. We're going to do the first 45 that we get. At some point you need to break it off. We're not going to try and question your doctor's judgment. If they order it, they'll do it. If we don't have enough testing supplies for Friday, soon as we have enough testing supplies, we'll do another one, hopefully sometime early next week. So is there a fever criteria for the test? Again, these are most likely to be positive when people have measured fever. That is, you took their temperature and it was over 100.5. Somebody said, I just felt a little bit chilled. I had somebody call me today and they said they had a temperature of 99.6. 99.6 is a perfectly normal temperature. So we would like to leave it for people who have a temperature of 100.5 and above. So what do you say to the people who still claim this is a hoax or believe we're overreacting on it? Really? I mean, do you really think that China would shut down its economy for 3 months, that Italy would report almost 3,000 deaths as a hoax? I mean, I think we're past that. So we share that with protocols with neighboring counties so similar programs can be established there. I'm in Curry County. Actually, Curry County is going through a bit of a thing, but Sheree Ward, who's the public health administrator, and I have been in contact. We're going to try and get this done. This would be hard to do in a small county. This really took a village, and we have a big area here to get it done. Curry County is a small area. They may struggle, but we'll work with them to help them. And so why are stores required to abide by social distancing rule? And so the social distancing rule, there's not the social distancing police out there. If anybody watched our press conference today, I think we did it right. Everybody was standing 6 feet apart. We didn't have people sharing each other. I mean, we've had some terrible role models for social distancing. I mean, I think I cringe every time I see our president and the vice president and Fauci and all those old people being that close together. That's exactly how this stuff spreads. So we really should be apart. In terms of stores, won't have the social distancing police, but you should be. And that would be that when you're in line, stand back from the person in front of you. If somebody's looking at something and you're looking at the same thing, wait until they're done and then go there. So really this stuff's not going to hold in the air. So if they're looking at the soup mix and you want the soup mix, wait until they're done, give it a few seconds, go over to the soup mix, and you'll be perfectly fine. So some of this takes people. Now, there can be sometimes you are going to be closer. I mean, I think when you check out, you can't help but be within 3 feet for a minute. But again, we don't have to avoid every exposure if we just decrease our exposure. So I actually looked one day about how many exposures I had. In one day, before this was social distancing, I had over 1,100 contacts within 3 feet. Right? This was a day we traveled. We were at airports. I was in the airplane. We went to Comic-Con. We did all those things. I had 1,100 contacts in one day. And I was thinking, oh my goodness, if I had something, I could have given it to a lot of people, or if this was around, I would have gotten it. Today, I tried hard. I had about 25 social distancing things because I saw patients in the clinic today. I had to get close to people. But you could probably decrease it. And decreasing from 1,100 to 100 decreased my risk by 90%. And again, we can never decrease people's risk to zero, but decreasing 90% is pretty darn good. So the question is, can you have flu and COVID together? Andrea asked this question. We do not know, because what has happened in most of the COVID testing is they won't do the COVID testing if you're flu positive. We don't know if you can have both together. The Seattle flu study, which is doing this, will be able to tell us the answer, but not in time for this year. So if you get it once and get better, can you get it again, Dennis asks. And we don't know. There are a couple of reports of people who had it, got sick, and tested positive again. We don't know if they're still testing positive from the first time or they really got it again. The Chinese have not noted that recurrent infections were that important. So what should immunocompromised workers do, Melinda asks. Well, like anyone, you should increase your social distancing. If you're sick, you should stay home. If you have coworkers who are sick, they should stay home. And you might talk to your boss about doing something different than being at work around lots of people. I mean, there's a lot of stuff you can do by telecommuting these days. There's a lot of stuff you can do by stuff like Facebook Live. So, for example, at the Aviva clinic where I worked this morning, we had an all-staff meeting. Usually we have 150 people crammed into a place and we have breakfast and enjoy and hug each other and do that. What we did today is we did our meeting by GoToMeeting. Certainly wasn't as fun as our typical meetings, but we got the stuff done. So this is a time to be creative. I mean, I didn't think I'd ever do Facebook Live. I really am. I'm a man in my 60s. I didn't think this was the right answer, but it's worked out great. We're getting here. So if a child has a sporadic cough, should they be excluded from daycare? Well, the problem with this is it's so hard to know who has this and who doesn't. So even in areas where COVID was really going around, most of the tests were negative. So in Korea, they did 250,000 tests. They only had 8,000 cases. So 250,000 tests, only 8,000 cases, which means their positive rate was very low. And since their positive rate was very low, most of the people they tested were negative. And so most of the people with cough will be negative. In fact, we've done a bunch of tests with people in the hospital who were sick with pneumonia. You'd think they'd have a high rate, and only one has been positive. So it's hard for me to know if your kid with a sporadic cough has asthma or COVID, but still at this point, if people are coughing, have them stay home. Now, they might call their pediatrician. Many kids with a little cough will get a little bit better with some inhaled corticosteroids, and that would be perfectly safe to do even if they had COVID, and so that might help. And so how will you handle the info when we have another positive case? Hopefully not, but if we do, will we know the number of positives? Yes. Where they went, etc. So again, we'll do what we've done before, which is that we will do extensive interviews with people who are positive. We will find out where they went, and then we will notify the people who had close contacts, and we will contact them. Unlike measles, where it was important to know which restaurants they ate at, which ball games they went to, since this is not airborne, this is not necessary. And by doing that, it not only doesn't help, but it violates the OHA guidelines, which is not to say where they lived or where they went, unless it was going to help you. Now, if the story was they were a daycare worker, and we will definitely tell you which daycare they were at. If they were a hospital worker we'll certainly let people know what the story is. But for other regular citizens who are not healthcare workers, not. That was the last. Okay. So I need to remind people of the hotline. The hotline is still up. We've taken well over 100 calls now. They're open from 8 a.m. to 7:30 p.m. This is staffed by volunteers who are call screeners. These are just regular citizens who come, who help answer the phone, try and direct people to correct resources and such. You don't need any special medical training for this. I talked to a couple of people who did it. They said it was a hoot. So please think about doing it. We're also looking for doctors and nurses. We're, I think, scheduled out pretty much through this weekend, but we're always needing more people because we're expecting this to be up until the end of, till we don't need it anymore. My happiest day will be the day I can say, we're over this, we're closing the hotline, we're not doing any more testing because we're done with it. And that's my greatest hope that will happen soon. Again, the hotline number, 541-464-6550. In terms of testing, it needs to be ordered by your doctor. And again, don't hound your doctor tomorrow at 8 a.m. because the ordering slip and whatever will get out to them tomorrow morning. And then when we get it, we'll do this again. We'll do the testing clinic again Friday at 12:30. For people who want to hear more, I'm going to be on Lars Larson show tomorrow at 1 o'clock. I don't know how that's going to go, but I'll be there. There'll be a story in the newspaper tonight, and if you want to do it, I was on the KQN thing at 12:30 today, and we did a podcast of that, so you can get that on KQN. Again, this is Dr. Bob Danhofer, Douglas County Public Health Officer, with another in our series of Facebook Live events. Hope to see you again soon. Thanks.